we can all do this right from home. Thanks everybody for attending today. Again, as you're logging in, be sure to enter your audio PIN so we can unmute your line if there's a question or comment that comes up. All right, let's go ahead and get started. Thank you again, everyone, for attending today. This beautiful New York weather arriving here all of a sudden, sort of. So again, the beauty of telemedicine, you know, we don't have to be traveling to engage. The safety of our offices or our homes if you're working from home today. Have just a couple of things we want to cover. I'm looking to see if there's anybody from OMH on the line because they were requesting that we put them at the top of our agenda today. Just a couple of questions that we wanted to cover with them. Let me see. Looking for. If somebody could just raise their hand if they're from OMH, that would be great. I can unmute your line. As I'm waiting for that, again, if you didn't enter your audio PIN, I won't be able to unmute your line. So be sure to enter that audio PIN as you log in. I'm not seeing anybody from OMH. We had a couple of questions regarding the regulations that they were going to address. It could be that with the weather pattern, they just got kicked off. So I think with that, then I also don't know that we have anybody from. I don't know that we have anybody from DOH either. I don't see anybody. Well, thanks everybody for joining. There's quite a few attendees on the call, which is great. But our key speakers looks like they've taken the day off with the weather pattern that's there. Let me, just in case, I'm going to just give the audio conference number again. It's 1-631-992-3221. The access code is 859-655-283. Thanks, everybody. So the couple of questions we were going to have OMH address, there's kind of, again, been some confusion about the differences between OMH and DOH, and OMH's regulations and DOH's regulations. As far as we can tell, what OMH is telling us is that, you know, if it's not a OMH regulated facility, then their regulations do not apply. So some of our conversation last month was kind of around that confusion about the differences in those regulations. One of the things that has come up here recently is, again, where OMH's regulations apply. And the question that came up was, well, if you are an OMH regulated facility and you are acting as a presenting site or originating site, depending on what terminology we use, or if it's a spoke site. So if you're presenting the patient, the question was, do these regulations apply? And that's OMH regulations. And the answer to that from OMH was yes. If you're a presenting site, you're presenting a patient, then and you're an OMH regulated facility, then the regulations apply. If you are an OMH facility acting as a hub site, so you are actually the distance site or the site of the specialist, perhaps in this case a psychiatrist, then in that case, it's very possible that the regulations don't apply. So again, we're talking about OMH regulations. Then in that case, if you were an OMH facility and let's say contracting with, like an FQHC or an Article 28 hospital, and in that case, you are acting as the hub site or specialist site or presenting site, then in that case, you would be actually free from those regulations. Any questions or comments about that? Any questions? If you have a question, you can either raise your hand or go to the chat box and type in your question. That'll work just fine. Any questions out there? I am not seeing any hands raised or questions, although Andrew Solomon just put a nice link on here, which I could send you all, that talks about how the Boston blizzard kick-started telehealth at Massachusetts General. So that's a great link. Thank you, Andrew, for that. Did you want to make a comment about that, Andrew?
Well, I just thought it was relevant for today, although we don't have much snow over here in Maine. But certainly, like you said, a great use case.
Yep, it sure is. So I don't know if it's coming your way or not, but it's been pretty heavy for a while. Let's see. Oh, OMH is on the line. Hey, great. So Amy, I have just sent you the audio pin again. You could try 3 pound, see if that works. We were wondering if OMH might have been delayed because of the weather. Did that work, Amy?
We've been here the whole time listening to you say how we were on a snow day. Unfortunately our meetings are back to back and we couldn't get logged in fast enough to get our PIN number.
Yeah. Oh, there you go. Well, thanks so much for joining. I did a fairly long soliloquy there. So I don't know if you heard that, but do you want to comment on anything that you heard, or?
Caitlin and I were just laughing because I said I could just say yes, and yes, you were right. So, yeah, I mean, I think we covered it. The original regs that came out last year that were part of 599 allowed only Article 31 outpatient to Article 31 outpatient clinics to utilize telepsychiatry, and then our latest expansion basically allows any site to use it with the exception of ACT and PROS. If it is an Article 31 licensed facility, that's going to be the spoke site where the patient is sitting. They do need to follow the regulations, complete the administrative action. get telepsychiatry as an optional service or additional service on their operating certificate. But if the Article 31 is going to provide the doctor and be the hub site, they can do that with a non-Article 31 setting. We just ask that they let the field office know that that doctor is going to be used in that capacity.
All right. And so kind of drawing on that, there was a line in the regulations about the provider being Medicaid enrolled. So here's a question about that came up kind of in dialogue. So if you have a provider that's Medicaid enrolled, but they are located in a different state, so New York State Medicaid enrolled, but outside of New York State, and they're going to act as the specialist or the provider to an OMH facility. Would that be approved?
At this time, no. We're not approving anybody that's located out of New York State. They have to be, they have to be providing the service from a New York State Medicaid enrolled location in New York State.
So a facility inside of New York State, then that's what you're saying, right?
Yeah. And we're kind of, originally when these regs first came out, which was only August 31st, we were saying that it could only be a facility. We're now talking about the option of having it be a private practice. If the doctor is a New York State Medicaid enrolled, that private practice is enrolled as a New York State Medicaid site. We just, we're going to ask that the spoke locations, provide some additional information just regarding that location so that we can make sure it, it still meets the criteria regarding confidentiality and the ability to have the appropriate equipment and things like that.
Okay.
So hopefully that will be helpful.
Yeah.
To kind of loosen that up a little bit.
Getting better all the time.
Yeah, we're just to let everybody know, we're in the works already and expanding for the third go around to we'll be including licensed social workers, psychologists, licensed mental health counselors, so we're going to expand it even further.
Tremendous. That's great. Good stuff. Any questions for Amy from OMH? And Caitlin, you're on there as well, right?
I am.
Good to hear your voice.
We stole her.
You sure did. Any other questions for OMH? You can just raise your hand or hit the question box. Go to the question page. All right, I'm not seeing any. So Amy, Caitlin, thank you for your help, your assistance on that. I'm sure we'll have other questions along as we go along. Oh, here's a hand raised from Judy. Judy, you want to go ahead?
Hi, can you hear me okay?
You can.
You can.
This is Judy Amor from the University of Vermont Medical Center. I just want to make sure I have this straight in order to sort of alert our physicians. So am I correct that I would need to tell the psychiatrists here that they would not be able to practice in New York State, to facility in New York State?
Only only if the site is an Article 31 licensed site. If they're providing services to an Article 28 or, having some involvement with OASIS in some way, we don't regulate that. But if the location is regulated and licensed by OMH, so if it's an Article 31 site, then that's true. They cannot provide the services.
Okay, so it's the Article 31 that's the...
Yeah.
Yep.
Okay, thank you.
Mm-hmm.
All right. Any other questions for Amy and Caitlin from OMH? OMH? I don't see any hands raised or questions. So thanks again, guys. Appreciate that. I'm going to just check here. I see that there are some folks maybe potentially from DOH, but if you could just raise your hand for me, I could unmute your line and you could give us an update. Did I hear somebody? Maybe not. Well, as you're looking at this nice weather pattern on your screen, the interesting thing is we have like 31 people on the line. So that's the power of telemedicine, I guess. I'll expand that out so you can see New York State again. So how about Excellus? Anybody from Excellus on the line?
Mariah is on the line.
Oh, hi, Mariah. How are you?
Hi. Good. How are you?
I'm doing well. I saw that Eileen might also join today. Is she with you, or? She
may be in the office. I'm working remotely because we have probably 18 inches of snow.
Oh, Eileen, I unmuted your line as well. I think you're on there.
I am. Thank you.
Hi. So our great representation from Excellus. Maybe you guys could just brief us on what's happening in your world as it relates to telemedicine. Any new developments?
So a couple things. I just joined, so I wasn't sure if the team had the opportunity to review the Medicare Learning Network about the new place of service code 02 for Medicare. And if not, I'll forward that to you. I just got information about it this morning, and it might be good information for the team. What it's saying is, effective January 1, 2017, CMS is creating a new place of service code 02 for use by the physician or practitioner furnishing telehealth services from a distant site. CR 9726 updates the current POS code set by adding this new code, POS 02, with a descriptor that says the location where health services and health-related services are provided or received through telecommunication technology. It goes on to say that this telehealth POS code would not apply to originating site facility billing a facility fee. So I just thought it was interesting for me to see that new update from CMS. And and in addition to the new CPT modifier 95, and I thought that might be good information for everyone to know about.
That's great. Yeah, thank you, Mark.
And then
Eileen,
from an Excellus.
Oh, go ahead.
Oh,
go ahead. Keep
so
going.
Just from the Excellus side, just to continue awareness that on January 1st we will be expanding the remote access technologies benefit for our Medicare Advantage members, which will permit them to have access to telemedicine services which are beyond what CMS currently allows for or permits for their fee-for-service network.
All right. We just got a couple of questions that popped in. Mariah, this is from Iris Berman. She's with Northwell. She's asking, can we get a copy of what you just talked about? Could you forward something on? That'd be great.
I sure can. And just so everybody knows, it's the Medicare Learning Network Matters number. And I'll send it, but it's MM9726.
Okay.
And it's dated for implementation on January 3rd, 2017.
Okay. Looks like Andrew Solomon from the Northeast Telehealth Resource Center put a link up there as well, which I can forward on. that looks like it's coming from the Center for Connected Health. Is that right, Andrew?
Yeah, that's correct. That's a fact sheet that talks about the changes in the physician fee schedule for 2017, which includes some information about that place of service code.
All right, perfect. And then let's see, Cindy Gordon. Looks like she might be asking, and I can't unmute her line. Oh, there we go. Cindy, you want to go ahead and ask that question?
Mariah, what is the reimbursement for the Advantage Medicare patient going to be? Is it going to be the full reimbursement?
It is, yes.
Thank you.
All right. That's
sure.
Great. Eileen, how about you? What's happening in your world? I'm not sure if people have actually met you, so you might want to introduce yourself.
Hi, thank you. So no, I have not met anyone. This is my first time on the call. I work with Mariah. I am a workplace wellness consultant and largely work with employers to share and promote this program, but we're working together to really kind of establish what's our communication strategy, how are we going to educate people, how are we going to keep bringing people to this service. And really this is a big learning opportunity for me to hear all the scope of telemedicine on this call.
Yeah, we talk about a lot of different crazy things on here, so we're really glad that you're joining us.
Thank you.
All right. Any questions for Excellus? Any other questions about what they've shared or outside of what they've shared? All right. I'm not seeing anything. So again, thank you. Thank you so much for participating. As we kind of close out here, I just wanted to take a minute to give you a couple of updates and share with you our new website. We recently launched a website at the North Country Telemedicine Conference that was held in Lake Placid. And that kind of highlights the partnership between Fort Drum Regional Health Planning Organization and AHI. So let me see if I can help you see the screen here for a minute. So this is our website. You can hopefully see that on your screen. It is telehealthny.org. It's kind of a nice graphic visual website. You can see the logo there, the North Country Telehealth Partnership. This is something that we've been working on for quite some time. At one time, we had talked about the New York Telehealth Partnership, basically because of this Telehealth Learning Collaborative. Because we're really, interacting and dialoguing with partners all across the state, we talked about this idea of the New York Telehealth Partnership, and we're actually thinking that maybe DOH might take that on at some point. But this website really kind of helps with that. It goes toward that, but a little bit smaller in scope as we think about really just the partnership between the Fort Drum Regional Health Planning Organization and the Adirondack Health Institute. I'm going to click right here on our Telehealth Learning Collaborative page so that you can see this. This gives a bunch of recordings from past webinars that we've had. The last couple, September, October, we actually missed recording those. So we're going to put the next one up here on this page with November's, so today's. But you'll also see here that we've placed everybody who is or has participated with the Learning Collaborative, so a number of names down here. As you go to the site and check it out, if you have updates to that, we'd love to make that more accurate if it's not accurate at this point. But so right now, 34 different people on the call today, but there are a whole host of different organizations who are participating with the Telehealth Learning Collaborative. So this page you'll be able to access previous webinars, and the most recent webinar we'll put up there as soon as we're done. And so if you have questions about that, please let me know. And then also, as you reference this, you'll see here I'm kind of circling the click here to join us tab, so that if other people want to attend, they can just register for the webinar on the site here. So I'll also at this point click on this Telehealth at a Glance page, and this again highlights the Fort Drum Regional Health Planning partnership with AHI. But so to meet the team, you'll see a fine old picture of me there, and at this point I wanted to introduce you all to Katie Cook. So Katie Cook, this is Katie's first day on the job. Let's see if I can unmute her line. Courtney, is Katie with you?
Actually, Katie is at compliance training right now. It ran over, so she is not here. I'm sorry. I knew you were going to.
Okay.
She wanted to, but our compliance coordinator is only in the office once a week, so she had to see her today, so we could part of her first day onboarding process. I apologize.
No, so we're glad that Katie is going to be compliant. So that's great. Here's a nice picture of Katie anyway, and maybe the next Learning Collaborative will be able to introduce her. So she's starting today at AHI, kind of leading the efforts in the Adirondack region. So that's Katie. The other things that we've placed on the website here, for patients, you'll see that there's kind of some general information about telemedicine. Actually, in this space, right there, there's a Telemedicine 101 kind of video that helps people understand. And then we also included an interest survey for patients, just to kind of gauge, okay, well, if you're interested in telemedicine, would you be interested in seeing a specialist or seeing your primary care via telemedicine? Let us know about that. And there's also a question in there about if you were not using telemedicine, what would you do? And so there we're trying to actually get at the idea of ER visits or urgent care, are those potentials that we could avoid. And then on the For Providers page, this gives a bunch of information to providers, and really we're kind of targeting providers through the website just to get a sense of their interest in providing care, and certainly not just in our region, but especially in our region. So we give different information here, the video conference room primer, best practices. I think there's a sense about etiquette on that as well. There's a webinar that Caitlin Huntington actually presented on billing some time ago. And then a survey here to find out if somebody's interested in providing care via telemedicine. Here's a page that I'm really excited about. This one gives various applications, so clinical applications for telemedicine, and kind of some highlights of different ones to look at here. So, for example, I'll just click on endocrinology here for a minute, and you'll see what we've done is we've actually copied this from UC Davis. So UC Davis, I actually had a conversation with Jim Marson at an American Telemedicine Association conference, And he said, yeah, you should use these. So what it does is it gives a specialist a sense about, what types of things could I do via telemedicine. And so here's some examples of different conditions that could be assessed via telemedicine. And a lot of this stuff I don't even understand. So not being a diabetes expert or an endocrinologist, I don't know what this is. But you'll see here there's also what level of presenter is needed. What amount of time would be required for a new patient or a follow-up patient? And what do we need for equipment? Just to give them a sense about that. So there's a bunch of different clinical conditions to look at here. Just open up cardiovascular, hypertension. Again, a bunch of different things to look at here. In this case, you'll note that patient exam camera would be great to have for many patients in this case. So then you'll note here too we have a regulations and legislation page, and so here I've just put on OMH's regulations and then DOH's proposed regulations. Looks like it's a little bit slow and loading there. There you go. So hopefully you can see that. So there's OMH. There's kind of a presentation done by OMH that's on the regulations, and then DOH, their proposed regulations. So let me pause there for a second and see if there are any questions. Any other questions coming in? Anyone have a question about the website so far? Up to 36 people on the call. Look at that. Okay, I don't see any questions. Any hands raised? Well, as you get a chance to review the website, boy, we'd really appreciate it if you could, provide any feedback, or if there's anything on the page that you have questions about, or if there are things that you'd like to see on the web page, boy, we'd really appreciate your input around that. So, without any other questions that I can see coming in, I think, here's another question. Alita, I'm trying to unmute your line, but I think you haven't entered your audio pin. So, let's see if I can go to your question. Trying to find it. I'm sorry. I see that you have a question, Alita, but I can't seem to find your question. Oh, hold on. Here's the question. What do you know about the likelihood of New York State parity regs being introduced and subsequently passed in 2017? Well, that's a great question. I see that Wade Abbott is on the line, and maybe I can just check in with Wade. Wade, any thoughts on that question?
I think it's a little early to know any details on that. I think the legislature, in particular on the Senate end, is still kind of figuring out who's going to be there. So,
yeah.
There's still a couple of races to be decided. There's still some question as to who's going to have the majority, although it's looking like things won't change much. And I don't have any specific details on any of the legislation at this point.
Okay. Yeah, I kind of thought that might be the answer. But we're hopeful that come next year that's going to be reintroduced, and
I will certainly I'll certainly make note of it that it was brought up during the call and pass it along to the director of the Rural Resources Commission and the senator that I work for as well. So,
great. Tremendous. Thank you, Wade.
Yep.
All right. Any other questions that I might have missed here? Oh, it looks like maybe Katie is on the line. So I'll give her a shot here. Katie, if you're on the line, say hello, introduce yourself.
Yes, I am on the line. Hello, everybody. My name is Katie Cook. I am the new telemedicine project coordinator with Adirondack Health Institute. I'm going to be working closely with David here over the time being of the unforeseeable future. Very excited about joining. I'm excited to work with everybody.
So thank you so much, Katie. We're looking forward to having you, and we're talking with folks all across the state, but targeting the Adirondack region for you. Excited about what you're going to do in that area. So.
Yes, me as well. Thank you.
All right. With that, if there are no other questions, I want to wish everybody a happy Thanksgiving. And we will be on the calendar again. It's actually right before Christmas break, but December 19th is our next Telehealth Learning Collaborative. Hope you can join us then. And with that, we'll say goodbye. Thanks so much, everybody.